This week, we'll be discussing some basic concepts in social welfare. Each of these basic concepts that I'll be discussing will be expanded upon in a reading for this week. The first is, what is social welfare? To really start off the class, we need an understanding of what exactly social welfare is. Social welfare is essentially a expansive list of programs that are provided by the government or a social service agency that is trying to ensure basic needs and quality of life for all citizens. This class will focus on social welfare programs and services, specifically in the United States, but social welfare can be international and certainly are provided in other countries as well. So there's a lot of social welfare programs out there. This is by no means a comprehensive list. These are just some of the more major social welfare programs. Some of these are ones that we typically think about when we hear the word welfare. We might think of unemployment or TANF, which is public assistance, Social Security, supplemental security income, which is SSI. So some of these are ones we kind of always think about. However, other programs on this list are social welfare programs. They are to kind of enhance the quality of life for everyone, not just people who are in poverty, but for everyone across the country. But we don't always think about them. So if we think about federal student loans, a lot of students have federal student loans, but you don't always associate that as a social welfare program. This idea that certain programs kind of jump to our head when we hear the word welfare, whereas others don't, is very common. So there was a survey done with Americans, and Americans were asked, have you received government social program? Have you participated in a government social program? Only 43% of Americans said, yes, I have participated in a government social program. However, when they were presented with this list of these social programs, 96% of Americans then said that they had participated in one of these programs. So this concept that most Americans are participating in social welfare but not realizing it is called the submerged state. So this is the idea that most social welfare programs are invisible to the public eye, that people are participating in them without actually realizing it. So submerged programs, which is at the top of this list, a lot of times those are exemptions or tax exemptions. For example, when you file your taxes, if you have a home mortgage, the interest on your home mortgage you can deduct from your taxes. That is a social program. It's to enhance your quality of life through housing, to make housing more affordable. There's different health insurance exemptions, childcare exemptions, student loans would be a submerged program. So if you think about an iceberg, only 10% of an iceberg is above water. 90% of an iceberg is below water. The US social welfare system is just like that. Most of them are submerged below water. What we see in this graph is the submerged programs are on top, and the bottom shows how much we're spending on them annually. And most of our money for social welfare programs are going to those submerged programs. They're going to programs that people don't really associate with welfare, that is available to all Americans, or large number of Americans without people realizing it, and they are taking advantage of it. The ones at the bottom are those visible programs, what we commonly associate with social welfare: food stamps, unemployment, public assistance, housing vouchers, but we spend far less money on those programs. So the US spends billions of dollars on social welfare programs, as we saw on the last slide. So why is it that the US chooses to invest in social welfare programs? Couldn't we just let people fend for themselves? So there's a variety of reasons that the US and most countries in the world choose to spend money on social welfare programs. The first is just altruism, that we don't want to see people suffering. We want to help people in need. We have this intrinsic idea, this intrinsic value to help others. However, it's way more than altruism. There's so many other reasons that we want to ensure the basic needs of people are met. One of them is the survival of society and social control. If large numbers of people are going hungry, don't have jobs, don't have housing, there's going to be some social upheaval. We've seen this when there's, there's been some civil unrest, when basic civil rights are not being met. So to kind of appease everyone, we need to provide a basic level of social needs, have those levels met. We've really seen this, especially in developing countries, like Venezuela right now has had some recent civil unrest, protests, riots, looting, because there's been widespread inflation. There's been a lot of some food shortages, gas shortages, and as a result, people have taken to the streets and kind of asked the government, what are you going to do about it? We're struggling. The government is here to take care of us. So that's why one reason that we invest in social welfare programs. The other is that, the US is built on this capitalistic society. Capitalism kind of dictates that the businesses are going to be in charge. However, when businesses are in charge, sometimes people get left behind. So we also need social welfare programs to relieve some of those problems that are caused by capitalism. So, if we think about the way that schools are funded a lot of times through property taxes. So schools in higher income areas have more money, schools in lower income areas have less money. That's kind of dictated by capitalism. The money goes where the money is available. However, that's not really fair to kids who are living in poor areas. So that's why the US government kind of steps in and relieves this idea that, if we're going to allow schools to be funded by income taxes, the US government has to make it a little more fair. So that's why they provide some special funding to Title I schools or lower performing schools. We also have social welfare programs to kind of rectify past or present injustices. So if you think about affirmative action, affirmative action has come about to address the fact that for centuries, certain groups were not given the same rights and opportunities as others. And to rectify that, they might get special dispensations when they apply for jobs. Indigenous groups get special exemptions when we're thinking about land rights. So there's some social welfare programs that are simply there to address the fact that things have not always been fair over time. If you think they have been fair over time for everyone, we will discuss throughout this entire semester how that is not accurate. There's been a lot of injustices for certain groups. So when and to whom does the US provide social welfare services? So on the vertical column, we have the when. When do they provide services? There's two times when the US might provide services. The first type of services are called residual services. So these are when normal resources aren't available. So this is where, if we have an emergency, so FEMA steps in when there's emergencies, food stamps, CHIP, which is the Children's Health Insurance Program, those are stepping in when people don't have food, when children don't have health insurance. So these are when normal resources aren't available, the US steps in. There's also institutional services. So these are services that are part of the normal structure of society. Think of public education, the fire department, Social Security, Medicare. Those are just kind of accepted as this is the way our society works. We're going to provide income. We're going to provide health insurance for older adults through Social Security, Medicare, public education, fire department. These are all things that are kind of just taken for granted as always being available. The other thing that we have to keep in mind is to whom does the US provide social welfare services? And the who is either it's a universal program where it's available to everyone, or it's a selective program where it's restricted to certain groups. So we see that FEMA is residual because it's kicking in when things aren't available, when services aren't available, because there's been an emergency, but it's available to everyone. So if there's a hurricane in New Orleans, everyone in New Orleans is going to have access to those services. However, with food stamps and CHIP, those are residual because they're when normal resources aren't available, but they are restricted to certain groups based on income. So only you have to they're called means tested programs. So only certain groups get those. Social Security and Medicare are also selective because those are only available based on age. So you have to be over the age of 65 to receive those. The next thing we need to understand is, how does the US provide social welfare services? And the how is physically, how do people receive their services? And there's three different types of ways people can receive social welfare services. The first are through direct benefits. So the US is physically sending you a check, a Social Security check, a TANF check. So TANF is temporary assistance for needy families, and that is public assistance. So when US physically sends a check in the mail, that's a direct benefit. However, the US also provides what's called in-kind benefits or vouchers. So these are kind of like physical, you get a physical good or a coupon to get a physical good. So if you're provided with public housing, either through a public, so you're provided housing subsidy either through Section 8, which is a voucher, or a physical public housing apartment. Those are, you're physically getting the apartment, or you're getting a voucher to actually have an apartment. WIC is also another example of an in-kind benefit, because you get like coupons for a loaf of bread, coupons for infant formula, coupon for milk. So it's going towards one thing in particular. The US also provides services. So if you think of services where it's one person is providing a service to another, so Medicaid, which is health care. So it's, you're physically going to the doctor and the doctor is providing you a service. You're not getting cash, you're not getting physical goods out of it, you're getting that service. There's foster care case management, mental health case management. So these are where individuals work one-on-one with individuals to help kind of manage all of the services that they're being provided. The other thing that we need to understand is how social welfare policies are developed. So we see a lot of these policies, TANF, unemployment, food stamps. Those are the policies. Where do they come from? Essentially, all of these are coming about first because of a social problem. We have a social problem where individuals are going hungry. We have food insecurity. And to address that food insecurity, we have a policy of food stamps. However, the policies that are set in place are dictated by the beliefs and the values of individuals. So different people have different values, and depending upon that value, our policy is going to look different. So if we think about food stamps, so some people, if your value is independence and self-sufficiency, then you're going to be not as in favor of food stamps. You're going to see that as kind of a handout. And then you might, maybe if you're in favor of self-sufficiency, you're only going to want food stamps if we have work requirements. So people have to be working to receive food stamps. However, if you don't value self-sufficiency and your main value is caring about others and making sure others aren't in need, you're going to be in favor of food stamps without work requirements. You're going to just give them out to anyone who has some sort of financial need. The thing to keep in mind is a lot of times those values have some conflicts. So it might be that you value both helping others and self-sufficiency. So when we're thinking about policies, we have to take into account all of the values and the fact that one person might have multiple values. And that's why we have some compromise policies and some very complex policies, because of all of the values that are kind of in the system. So one example of how values really guide policies, if we think about physician-assisted suicide. So physician-assisted suicide is legal in several states. It first was legalized in Oregon and Washington. So physician-assisted suicide came about because of the social problem that individuals who had terminal illnesses had a lot of pain and a lot of suffering at the end of their life. So people who value independence and people who value self-determination, so the right for individuals to make their own decisions, would be in favor of physician-assisted suicide, because they want people to make those decisions for themselves. However, people whose value is spirituality and morality might be against physician-assisted suicide because they see this, that it is not, it's in conflict with their religious beliefs. And one person could have both of these values. So that's where we can imagine that if you have both values, it's going to be hard for you to make a decision. And what ultimately one value is going to have to kind of supersede the other. So that is all that I have for this week. If you have any questions, please feel free to shoot me an email. Thanks.